They don't know what they're doing, and we need to educate the public to use their feet and walk away.
Comment le public peut-il être davantage informé? En exigeant le respect d'un droit médical essentiel, peu connu des patients, mais que les psychiatres connaissent très bien.
We want to be able to present the patient with alternatives. And one of the central ideas in ethics is informed consent.
The components of informed consent are letting the person know, first of all, what the diagnosis is and what it's based on, so that they can say, this is why we need to treat you. And secondly, what the treatment is.
Every patient in the healthcare system has a right to informed consent. That is, they have a right to be told the risks and benefits of the treatment, the risks and benefits of alternative treatments, and the risks and benefits of no treatment at all.
Patients should be totally informed, fully informed about every medication that the psychiatrist offers to them to take or says they should take.
Et les études confirment que le public ne reçoit que peu d'informations complètes et exactes au sujet des psychotropes. Quelles informations complètes et exactes une personne devrait-elle recevoir avant de consentir à prendre des psychotropes? Les médecins et spécialistes présentés ici ont une grande expérience dans ce domaine. Premier argument qu'ils avancent, les troubles psychiatriques ne sont pas de véritables maladies qui nécessitent des soins médicaux.
It's true that there's no biological findings that really support any of these psychiatric diagnoses being medical illnesses. And the burden of proof really is the other way around. It's not that you have to prove that there is no biological science. The burden is on psychiatry to prove that there is.
There's no blood test. There's no lab test. There's no X-ray. These are just clusters of behavior that a group of psychiatrists have voted that it's a disease.
Can you imagine doctors having to have powwows to decide if a heart attack is a real disease or not? No, they don't have to decide that. They don't have to have a vote on that.
They should be asking the doc, geez doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told, we don't have a chemical test for that.
There is no such thing as a chemical imbalance. And any psychiatrist that you talk to, if you ask him this question, they'll all admit it in private, but they won't admit it in public. It's a scandal.
So this is all subjective. Nothing objective about psychiatry.
Deuxièmement, il n'existe aucun document scientifique prouvant que les psychotropes guérissent le moindre trouble mental.
Since there is no measurement for these psychiatric diagnoses, because they're really just subjective, for the same reason there really can't be a measurement for the effects of the drug.
In terms of medication, the evidence that's claimed is the medications are highly effective and not very toxic. But actually, in fact, the data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
Troisièmement, les psychotropes camouflent les symptômes tout en créant des effets secondaires graves à court et à long terme.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease, medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of deaths from psychiatric drugs? Absolutely yes.
Quatrièmement, les psychotropes peuvent créer un état de dépendance aux médicaments.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
Cinquièmement, la plupart des troubles mentaux proviennent d'une maladie physique.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?